Hi, thank you. All right, so joining me for our discussion today, I have John Short, EHRM Chief Technology Integration Officer at the Department of Veterans Affairs, Nick Weber, Program Manager for Cloud Services for Research at the National Institute for Health, Chris Nichols, Program Manager and Chief of the Enterprise Intelligence and Data Solutions at Defense Health Agency, and last but certainly not least, Jonathan Album, Federal CTO and Principal Digital Strategist at ServiceNow. Welcome, gentlemen.
Hello.
All right, so to start out today, I want to start with the high-level focus of things. Each of your agencies has developed strategic plans and goals centered around IT modernization, some specifically calling out the use of the cloud and others mentioning it as a viable option. Since those plans have been put out, you've all made great strides in realizing some of those goals. So what are the significant accomplishments you've made to date in each of your respective organizations in your move towards the cloud? Who wants to kick us off?
I can go. This is Nick, because I think you maybe teed up a little bit the program name and making great strides. So we have a program at the National Institutes of Health called the Science and Technology Research Infrastructure for Discovery, Experimentation, and Sustainability, otherwise known as STRIDES. And what we're trying to do is kind of make progress, make strides in getting our researchers at NIH and those that we fund across the country. NIH is a funding agency, funds about 300,000 investigators at 2,700 institutes and medical and academic research institutes across the country. And we've partnered with commercial cloud service providers to be able to bring to bear the tools, the technologies, the capabilities to our researchers to accelerate their speed to science. And that's been a program that we've launched about 2 years ago now. We have partners with AWS and Google Cloud in discussions with Microsoft and other cloud service providers as well to bring these technologies to bear and have seen great success over the last couple of years. About 350 research programs have enrolled in STRIDES. We've trained nearly 3,000 people. We've had about $10 million based on the cost, the negotiated price ranges that we have with our cloud service providers and cost savings to our participants, and a lot of great research capabilities and new innovations and discoveries potential for our research community. So that's been a major part of NIH's strategic plan for data science to really bring these tools and technologies to bear to scientific research and to combat things that we're dealing with every day with COVID and the pandemic and with many other health afflictions that many of us or our loved ones are struggling with. So we're excited about the program that we have at NIH.
That is exciting. John, Chris, anything from you guys?
John, you want to go ahead?
John Short, let me comment. As you know, VA's moving forward with a new clinical electronic health record, the same one that DoD started rolling out prior to our initiation into it. As part of our work, what we've done is we looked at wherever Cerner has the capability for their own internal Millennium Cloud services, we're utilizing those for almost all of our components. In addition to that, Cerner has announced publicly that they have a partnership with AWS, Amazon Web Services. And so we're looking more and more using that platform as well. We have a lot of integrations we did when we went to Grandstaff, our first hospital site, and majority of the interfaces that we had that weren't inside the Cerner Enclave, a good majority of those we actually put into AWS and or the Azure Microsoft Cloud, the VA Enterprise Cloud that OIT had set up. We put them there for resiliency, for expandability, and for flexibility. So it's worked out very, very well. We continue to look at that with Cerner and how we can best move to that. We also moved VA's historical data, 38 years of medical records, into Cerner's Healthy Intent platform, big data platform, population health analytics, which has given us a lot of flexibility of what we do going forward, especially if we look at using more cloud platforms. Over.
So on the DoD front, on the military health front, so we really started this path about 2.5 years ago, and actually increased our time because of some things this year I'll explain. But it was brought in about 2.5 years ago to really aggregate all our data together because it was all disparate everywhere around the organization, right? Not just health data, but many other data sources. So we really set up a secondary data PMO, and that's what I manage now. really focus around efficiency with data, efficiency, speed, trust, intelligence, and enabling that user experience. And the cloud piece is a piece of that, right? And so for the last 2.5 years, we've consolidated about 22 warehouses and re-platformed about 14 applications into what now we're calling the MHS information platform. And due to various reasons, we are on an 18-month plan to move everything to AWS GovCloud. We enhanced that timeline starting in late February, early March. Yes, it just happens to be the same time as COVID, but it had nothing to do with that. That just became a doubling effect, right? Because of data needs. But in about a 16, 17-week period, we moved everything from an on-prem data center into AWS GovCloud, which meant a lot of work by the team and a lot of effort to get there. The big part of that is now spending the last 4 months since then to really smooth out the edges, really working on role-based access around everything, focusing on our compute and store, which is critical. We're not smart about things, and this goes with cloud across the board. You know, we've decreased our cloud costs over the first month. We've actually dropped it in half because we figured out how to manage, starting to figure out how to manage things the right way. Focusing on data management, operating instructions now, versioning, platform efficiencies as a whole, because as I keep on telling the team, the amount of work to us is not decrease, it's going to increase, right? And so we need to get as efficient now, so then we have that buffer so we know how to manage this accordingly from a cost and performance perspective. So that's kind of where we've gone and come to in the last couple, and then now the focus is what's next.
If I can just jump in, I think.
Please go ahead, Jonathan.
Yeah, I was just to say, I think one of the very interesting, themes, across the three stories is the importance of data and making sure that the data is stored well and that there are ways to access the data that are easy. And cloud's a great tool to be able to support that. I love the idea of being able to consolidate warehouses and create more access to data. But if we're going to do these cloud migrations, and I did a lot of cloud migrations when I worked in the government, we have to be thinking not just about where the data is and what it is, but once it gets into the cloud, how do people have access to it? How do they request access? How are they able to trust that the data that they have is the right data? So there's a lot of additional planning and thinking, I think, that, is behind these stories that is really important for people to understand. It's not as simple as just buying an AWS or Azure instance or a platform technology. You really have to be thoughtful about what you're trying to accomplish and how you'll operate in the future.
No, Jonathan, on that, I absolutely agree, right? I mean, it should be technology last. It's really about the people in the process. And if we don't get that right, we should never be inserting a piece of technology at all. Because inserting a piece of technology into something does not fix the underlying problems or issues that are occurring. And we have to focus on those processes and people and how to manage that capability the right way.
Yeah, I'd like to totally tell Jonathan said just briefly, and that is we're dealing with health IT in my realm and a lot of other people's realms here. And people can say data is data, but health data is very more unique. You have to be much more careful with it. If you get a bad transaction and you're missing $1, that's one thing. If you have a bad transaction and your medication doesn't arrive or wrong one comes there, that's a worse problem for that individual. So you got to be critical with health data. One of the things we did when we moved the 38 years of data from VA to Cerner, we actually cleaned up the data more with clinical informaticists, medical doctors, and their staff to going through it, making sure the coding was correct for different national standards, Loic, RX norms, SNOMED, and also where there was errors in the data, they were able to clean those up. And then they were able to take those that they did to clean that data with tools that they did and provide that back to the legacy side to say, here's the areas we cleaned up. Now you can go back and clean up the legacy data as well in the current systems. So I think that's one of the critical things. Anyone can just move a chunk of data. I mean, that's easy to do. But to do it secure and to clean up the data and then make it effective when you get it there and not overspend on your infrastructure, that takes work. Over.
Right. So I think you guys bring up great points, and I think we're getting into our next question a little bit on, the long-term benefits that you want to realize, right? So I think you touched on a lot of those. So on your way there, what are some of the challenges that you faced along the way, right?
Go again. So yeah, I think one of the major challenges was also an opportunity for our broad biomedical research community that NIH supports is around training, and that's both for kind of the IT staff, the people building and supporting the infrastructure. That's for our researchers who are trying to use these tools and understand a new way to work with tools and data and share data and collaborate. And also people who liaise between them, which we found to be a very important capability. People who know both the research side, the IT side, and can help to make sure that our business users, who are generally research scientists, have the support and understanding and don't have to worry or care so much about some of the underlying fundamental IT components, the networking, the identities, the other pieces. We need to make sure we get that right so that their jobs are easy and they can focus on their science. So I think building a workforce that understands this new way of working, that understands their different roles and responsibilities, especially when the cloud gives you so many tools at your fingertips, it's overwhelming sometimes. So to really be able to have a robust training program in conjunction with the work that you're doing technically to move to the cloud has been one of our biggest challenges and one of our biggest opportunities. And we've invested very heavily in kind of that training component to build, to earlier points, those people skills around this so that the technology that we're bringing to bear can actually be leveraged properly.
So I think those are, Nick, those are really good points. And it's not just people with the right skills to interact with the new applications. I think it's also people with skills who can think creatively about, well, what should the process be now once we get out of some legacy systems, and we can rethink and maybe redesign how we do our work or how we access the data. I think John said it really well. It's not just picking up a chunk of data and moving it. Anybody can do that, but to do it and get value out of it because you maybe rethought the way the workflow exists, or you cleaned up the data. I mean, I think that's really the magic, and to the extent that you can get people's minds around the idea that there is new technology that can help us, but we also can reinvent the process. I think kind of, as Chris was saying, it's people and process first. That's important. And too often I've seen that cloud just is a technology idea, but it's part of maybe an organization's digital transformation, you could say. And that's a team sport, right? That's a whole of the agency endeavor, and you really need leadership from the top down to buy into it. So that, if you're talking about what are the challenges, it's getting leadership, I think, to see that the digital transformation you guys are talking about requires everyone to be involved. And once you get that, I think you can accomplish a lot.
So I think, go ahead,
As
John.
part of the focus of the value of that data, one of the things we had going up to the Go Live event we had at Man Grandstaff Spokane a month ago, we said we're going to move all the data into one platform. You'll have access to all the data into what's called a healthy intent platform for Cerner, and it'll trigger clinical decision support, reminders, that sort of thing. But then we're going to move a subset of that the clinicians said that they want to see in the EHR itself for transactional day-to-day activities. And so but a month before we went live, so 2 months ago, some people said, well, maybe we should go put more data in there. And the clinicians already looked through and already determined what they wanted in there. But some people were saying, maybe we need more, maybe we need more. Day before we went live, maybe we need to put more data in there. And we were live for 3 days, and people said, maybe we should relook, and we said we wanted X in there, but maybe we need only part of X. So as soon as they saw how much data, even only the 3 years, they only wanted to see 3 years of other past transactions in the common EHR. Once they saw it, they said, for these couple of areas, maybe we want to see a little bit less. And so that we're still, learning that. We're getting their feedback, determine what that right piece is. We want to give them everything they need to operate, but not so much that they can't see anything, right? Because then they can't get their work done. So that's that blend of make it agile enough where you have that right data at the right place, at the right time. Just kind of like, Steve Jobs, it just works, right? You want the technology to disappear and people to be able to do their job better. And so we have all the data on one platform. They can always go do research on it, look at a long-term item, they can see all that. But for their day-to-day stuff to be efficient and to be able to treat the patient the way they like, we have to fine tune that. We got really close to where we need to be. Most of them are happy with that. And we're still looking at at different pieces of that data to see should it be modified. But I think that's one of the key is refining that so you make sure it's most effective and not just hand it off and say, okay, we did something and you better use it. We need to make sure that the customer has what they really need to where they almost forget all of our names. When the functional people are forgetting who we are, we've done our job well because it just works. Over.
So Fernando, you asked about challenges with cloud transition and utilization of cloud. I would actually say the opportunities as well, right? I mean, pure and simple, just like Nick is in with NIH and the VA as well, right? We're all large research institutions and organizations, right? And simply put, the compute capabilities as we move into the cloud space, because we're still learning when in the data space, right? We're still learning, and the value of data is aggregating it all together and starting to build the ability to start to the deep learning aspect of things and from insights and everything. And so you can't do that without the right compute capability. So that to me is the core. And then from that, it really is about, the ability to integrate all those disparate data sources I was just discussing, right? I mean, we're looking down the path more, I'm a data guy, I'm an informaticist, but I'm actually a clinician by background. And so what I'm thinking about is how do we get to the right things? And it's not all clinical data that we need, right? It's purchase care data, it's billing data, as well as staffing data and all these other things, because that gives us the ability to start to really look at how we manage. But those are the things that we're going down this technology path around implementing and modernizing and stabilizing our cloud maneuvers, but then it's really about, in a parallel path, starting with the new domains about bringing in genomics data for precision medicine, social determinant data, device data, biomedical device data being take home as well as our personal device, but also biomedical device, right, in the facilities. In my space, operational medicine. That's another space that I'm looking at, and how do I bring that in? Because that will help drive things as well. And then in my space too, legacy. As we're looking in the legacy space, I'm accountable to shut down those systems and bring in all that data into our platform, and then transfer that and integrate that with what we have with MHS Genesis on the future state EHR side. But how do we integrate all those things together? And that's the stuff that we have to do in a parallel path, as well as, and that's really becoming a learning health system in our space. Over.
Okay, great. Yeah, and you touched about on the learning and the ability to really leverage those benefits and realize those opportunities, right? And that relies heavily on partnering with cloud service providers as well, right? Bringing in their knowledge and everything that they bring to the table as well, which is a bit of a different model than we're used to in the government space. So what are some of the considerations made in deciding to partner with industry?
I can go again if we're going with the same order. Yeah. So we've had incredible I can't say enough about how strong our partnerships with the commercial cloud providers and others that they bring to bear, distributors, resellers, et cetera, to making this work. And we've been able to come up with win-win scenarios. I think in the past, we might look at these as kind of vendor relationships and kind of one way, and these need to be very two-way, very kind of open. We bring professional services folks in all the time through dedicated engagements and ad hoc to really understand how can we start to kind of position ourselves and position our teams internally to extend our data center out to the cloud and do it in ways that are kind of under best practices and that they've supported many other organizations in doing. So we've found that they have so much kind of knowledge and insight and interest. One of the things that comes through very clearly is I think we look at the mission first, and we look at the objectives, and we look at what we can do together to make new discoveries and build new capabilities and figure out interesting ways, the art of the possible, like Jonathan was talking about, for using these tools for making new discoveries. And that excites everyone on the team, whether it's somebody on the NIH side or somebody from the cloud service provider side. And when you're kind of sitting on the same side of the table trying to figure out the best solutions, how can we do this? This is exciting. You get this momentum and snowball effect that, again, is very different than what I've experienced. And what you mentioned, government relationships typically are is very, kind of one-way contractual, do this for us by this time. When we're looking at it, more collaboratively, we're able to get so much more done in my experience. So it's been a great relationship with our CSP partners.
John?
To tag on to that, I would just say, I mean, there's no one in the federal sector, honestly, let alone the private sector, can do this themselves, right? And do all this themselves. And so it is an absolutely partnership, as Nick was saying. And it's really about, as Nick was already saying, finding the right industry partners, having, as well as having inward honest conversations inside the team and inside the organization on what is needed and what is necessary, not being caught up with everything that's coming down the pike and really looking at it from a strategic perspective and a planning perspective and how you incrementally put the right capabilities in at the right time. And that also helps foster those relationships with your industry partners.
John, anything from you?
Nothing additional on that. Thank you.
Yeah, I would just, from my perspective, having worked in government for a long time and then having moved into industry, I think oftentimes, industry sometimes needs help to understand the mission and what you're trying to accomplish and get away from the idea that you're buying technology because you like technology. You're buying technology because you're trying to help a veteran. You're buying technology because you're doing cancer research. You're buying technology because there is a mission behind that. And I tried to do this when I worked at USDA, and I think it worked pretty well. And I don't know that it always happens, but let's connect this purchase and let's connect this cloud service we're buying here with the citizen, with the researcher, with the patient. And I think when you make that connection, you create really good engagement. And some of the conversations become less about the contract and more about the outcome in a really meaningful way. So I just offer that as advice, something I've seen on sort of both sides of the fence here.
Thanks, Jonathan. And what about from a technical solution perspective? Are you approaching these massive technical challenges in a different way than you have previously?
Well, we've talked a lot about data, and we've talked a lot about, the need for integration. And, one of the things that I've worked on since I joined ServiceNow is really the ability to leverage the data in these sometimes legacy systems or maybe a system of record, and using, workflow technology to use that data, leverage it via workflow to get to an outcome, to get to an answer, or to complete a service for somebody, and trying to automate those things as much as possible. Too often, the complexity that's sort of grown up in our environments over time, requires somebody to go to multiple systems to get an answer. And it does sound like there's people are thinking about how do we integrate this data. And I think integrating is one thing, and then leveraging it through workflow to drive to mission outcomes as quickly as possible, and making it simple for people to get the service that they need, whether it's a patient or it's a researcher or what have you. That's what makes the difference. And I think as John was saying, that then we just disappear as providers, and the functional people can do their thing and ideally do it a lot more efficiently, because what they need is at their fingertips, and they can get to it through a mobile device, or they can get through it online, or using the tools they're most comfortable with. Let's minimize the change they have to go through.
Let me dovetail. I'll just add one thing, that is, and I looked at some of my readings on Elon Musk. He talks about it a lot, and that's DeEngineering. We often go to these complex things that they work, but we need to take the next step to de-engineer that solution and make it less complex. When we make it less complex, we lower the cost, and we also lower the risk for the user. We lower the risk for ourselves to maintain it, and we usually lower the overall complexity everywhere else. And so it's easier to integrate to that thing in the future, easier to migrate to something in the future. So we constantly need to rapidly find a good solution, and then spend the time de-engineering that solution instead of what we typically do in government and sometimes large contractors is take a long time to develop a big solution. We shouldn't do that. Rapidly come up with a solution, even if it's ugly, and then de-engineer it, and then it will reveal itself to a more flatter and less complex solution that'll work for everybody. That's what helped us be successful in OHRM the last few years and going live and with a ton of integration, but we made those integrations less complex with the same functionality. I'm not saying strip out functionality and give people nothing. You can give them all the capabilities, but do it in a way that's less complex that benefits all of us. And the cloud can help you do that. Again, if you do the rapid prototyping first and then de-engineer that solution to make it, again, flatter. Thank you.
Right. Okay, so continuing on with the partnering theme, since each of your agencies is trusting external commercial organizations with sensitive government information and data, we'd almost be remiss not to cover the topic of cybersecurity, right? So can you tell me a little about the cybersecurity measures you've taken to prevent data breaches while also maintaining data integrity that we've covered a lot today in your transition to more mature platforms like the cloud?
Sure. So we've kind of really worked with the partners as well to kind of follow the shared responsibility model and then build a set of shared services for our customers. So it's really about kind of collaborating and making sure everyone is clear on what the technology capabilities are. It's well documented. We go through the process, FISMA and FedRAMP related processes for inheriting cybersecurity controls from the cloud service provider. The things that we build at NIH on our platforms, we tend to focus on kind of providing a set of services to our customers around secure high-speed network connectivity and identity and access and those sort of pieces. And then we allow for our customers to kind of inherit all of that kind of common cybersecurity baseline and build from that for the systems and solutions that they're building on our platforms. And we've seen a lot of just transparency internally around that process, around the controls, around how we've implemented things, partnerships with different groups, our security operations center, our incident management and vulnerability management teams, et cetera, to really make sure they know what their roles and responsibilities are. We've tabletopped exercises to understand how we can respond to an incident. We've had incidents before where, incidentally somebody's access keys get posted to a public GitHub repository, and your cloud spend is going up over the weekend, and addressing those and building in process improvements to make sure that we're scanning for those sort of things and that doesn't happen in the future are all important. So kind of taking a retrospective look at things as they happen and build that into kind of the way that we harden in the continuous diagnostics and monitoring that we do for our system. So it's definitely critical. To your point, from a public perspective, you're trusting these companies with all this data. What do you mean? But also on the contract side, making sure that it's very explicit, that we are the owners of the data. We're using the technology services. We're not, granting, technology companies access to do whatever they please with, sensitive health information. And being clear about that with, kind of the public is also very important, so there aren't any misconceptions.
So I think, from obviously, in the DoD, we probably have some of the strictest cybersecurity aspects of things. On top of that, you layer in my space the necessity from a PII/PHI perspective as well, right? And so it's absolutely difficult, but I think what we have found with us doing this transition this year, it's given us the ability to really focus on continuous monitoring, right? And actually make that a part of the way we do business. And so it's allowed us in that cyberspace to change our processes, make some real decisions around, from a technical perspective, isolating segments of our environment based upon our ATOs. I mean, we did 4 ATOs for a reason. We did a data logic presentation layer different within the same capability for that reason. So we kind of have some of that modularity of things so we can manage it better. And it's about leveraging approved services that are already out there, right? In our space, if if this has already approved something, it's looking at what is already approved so that we can inherit that, increasing that speed to bring the right things in from a cybersecurity perspective. And the team's done an amazing job.
John?
I would say ditto to what the comments already said. Again, some of it's going back to basics, layered defenses. We worked with DoD on a construct where we're inspecting all the medical traffic, especially those Internet of Things out on the edges, very close to where they're being used. Then they get inspected before they get into the federal enclave. And so we're doing multiple inspection points. We have DoD and VA both looking at going on. So we have multiple ways we're looking at it. We have multiple inspection points. We're following the standards. VA's cybersecurity office updated its cybersecurity policy to mirror most of DoD's. That meant that we had more robust policies, as well as made it easier to do work with DoD. We moved to DoD's EMAS to have really good tight control of our cyber artifacts. Having a good artifact doesn't give you cybersecurity, but having those artifacts, doing all the work to get the right artifacts and all the scans and maintaining that will make you to the right posture. So we've done a lot of those things throughout the enterprise. OHRM has done that very tightly and interwoven with DoD and VA together very, very tightly, along with Cerner. Cerner has done a lot of things on their side to really bring up their game, their platforms that they're doing inside their own data center and their Millennium Cloud, as well as their commercial cloud platforms, to also meet those DoD and VA requirements. So we're going to keep pressing that. And then the last thing I'll mention is, as an industry, we need to press those medical device manufacturers, because, you know, it's a medical device. We can't do cybersecurity to break it. We need to get out of that. We need to have them putting that security in the very beginning. And so that way that we can have the right cyber at the Internet of Things, instead of having to put probes and monitors all around it to protect the environment. Over.
Absolutely agree with that last one.
I would just say at ServiceNow, we've invested very heavily in security, not just getting our government community cloud up to a FedRAMP high level, but we've achieved impact level 4 security in the DoD, and we're investing in MedCOI now, and we have a plan to get to impact level 5. So some of that's in our own government community cloud, some of that will be with cloud service provider partners. But there's a recognition that, if we are going to be a critical partner to, agencies in the federal government, we have to up our security game as well. And we've invested significant resources as a company. So I'm very, very proud of that. We recognize how critical, this protection of data and patient data especially is to our business and the government.
Right, that responsibility certainly cannot be taken lightly, right, Jonathan? So it's very clear that you're taking the steps that you need to meet or exceed expectations.
Right.
That's great to hear. All right, so we're almost near our time together. So I'd like to switch our focus a little bit and hear from you about what you foresee in the next 3 to 5 years in the government healthcare space as you look to leverage, all of the efficiencies, all of the benefits that we just spoke about in your move towards the cloud.
So I'll take this one first. So I think our next year is our last big year of being foundational. As I said, 2.5 years of consolidating, rationalizing, right? Advancing our timelines around cloud and moving to the cloud work. And so our next big year is really that last foundational, where we're focused on migrating our last big component of a warehouse called MDR into the MIP. And then really focusing also around data management and automated data mapping with some tools, data pipeline automation, and then finalizing our legacy data prototype work. And as I was discussing earlier, but then in parallel path, it's really about the so what. That's all great technology things, but it's really then about putting that innovation pipeline in, and then working with our broad swath of this very large organization worldwide around the work that they need done. And going back to something Jonathan said earlier about, prioritization and getting senior leadership buy-in, that's been a big piece of what I've been focused on, and getting those right types of boards put in place so we can get prioritization. But then also working as we identify what work needs to be done and what tools need to be there for our functional community. Most of our MTS are already solving these problems on their own because we haven't solved them, right? So it's working with them to find and harnessing the innovation that's out there everywhere, and then bringing it into the enterprise platforms and then scaling it in a timely manner. Otherwise, they're going to be doing this. They're going to have to solve their problems at their local facilities, and then it's really then also tying in the research in our space, getting to a point of having, the right abilities to have clinicians come in and get access to the data they need in a timely manner, so they stop doing pencil stubby analysis, and we can actually speed to market the research, and in partnerships with people like Nick and others out there, partner at the federal level and start building towards that true federal data hub in the federal cloud space, so we can drive change in this organization, in the world.
I can go next. For the next 3 to 5 years, I'll echo a lot of that. I think we're looking for much more system and data integration with all our individual research programs that we fund, and then what that means for patients or healthcare in general. So I'll give some examples. So we have obviously clinical trials and vaccine studies related to COVID. We have major cancer programs such as the Cancer Moonshot. We have a large opioid program to address the opioid crisis called HEAL. And we have many of these different types of programs, the BRAIN Initiative. Another one is the All of Us Research Initiative, where we're enrolling 1 million people for personalized health information, genomic information, medical history information. And those programs are all really important and impactful within and among themselves. But I think what we're really trying to do by bringing all of these to the cloud and bringing some standards and bringing some support and resources behind this is to really have questions to be asked across these resources at the point of care with a clinician to look at not only those data resources that have lots of information from previous trials or medical histories or what have you, but also information from the individual's social or geographic or device data on their Fitbits and those sort of things, to really inform what can we do specifically for you, knowing all of these things about you in data that are readily accessible and secure and all of those things. But what sort of outcomes can we have for the individual and then for the population at large, when we're not looking in silos or individually at how we treat things or at data sets, but we're looking broadly across them and connecting pieces in the clinic and in other ways. So that's what we really are aspiring to. We're seeing some good pairwise connections of, okay, we were able to connect this resources with these medical records, and I think we'll see more of that. All right, and the ecosystem will grow, and the questions that we didn't even know we could ask, let alone answer, I think are going to be really eye-opening and really beneficial to everyone. So I think that's what we're aiming for.
Great. John?
What we're going to see, especially with the Office of Electronic Health Record Modernization, as we roll out across the country, it's going to allow more and more systems to be consolidated and people go down to one platform. We had a nurse at one of the clinics say, "I'm so used to have to opening up 8 different screens, applications to be able to do my job, and now everything's integrated. I'm doing it at one place." We're going to be doing more and more of that as we move along and roll out the rest of the capabilities. That's going to allow the user to spend more time with the veteran and less time with their computer. We all love our computers, but for healthcare, let's spend time with the patient. That means better outcomes. That means more longevity, better quality of life for the veteran. And that means the clinicians, instead of having to figure out how to develop some software with OIT, common software that's commercially available, now they can instead spend that time they have available either with the patient or with specialty applications that are very unique to the veteran population, Agent Orange, et cetera, that may not be a commercial model. And that way, anything that's available, that's commercially available, that we can bring into the cloud platform, bring into the Cerner environment, and roll that out more and more. That'll allow, now OIT can focus on those specialty applications, and VHA can focus on that, on those research. Again, better patient outcomes, better quality of life for the veteran, better quality of life for the caregiver, because now they can actually do their job more efficiently. They don't have to come in for 2 days and do research and find all the data so they can treat the patients that week. They can have it readily available. So we're seeing the efficiency for the human and the technology, again, melting it away in the background to allow them to do their job much better. Over.
Yeah, and I think everything that I've heard, makes me even more confident in in the direction that, these agencies are going. And the idea that all of these different data sets, as they are integrated and brought together, makes it easier for the clinician or others to use. But ultimately, I think the connections to those data, there's a workflow element that's really important, because you have to be able to make the data actionable. Having all these data sets is great, but when you can apply machine learning or AI to them and recognize patterns, and then use those patterns and that learning through sort of workflow engine to drive to an outcome that helps a patient, I mean, that's when it's really important. That's when the data is really meaningful, because it drove a decision that helped somebody. And I think that's the future. And the data sets are the gas that drives that engine. And it's a really exciting time. It's part of the big digital transformation we're all undergoing. I think COVID's really accelerated it, especially in the healthcare space. So it's a very exciting time. And I actually have learned quite a lot today on the panel. So I'm glad that I participated.
Thank you.
Great. And I think these are great thoughts to end on. Thank you, gentlemen, so much for your time and thoughts today. And now I'll pass it over to my colleague, Alex Brown, who's paneling the topic entitled Securing Cloud with Zero Trust. Alex?